The next thing is gut microflora, or gut microbiota. So it is well recognized that those who have celiac disease and gluten intolerance do have problems with the normal microflora. Even though you may be gluten-free for years and years and years, your microflora are not normal. So what are the principles of restoration? So it's use of prebiotics, which I mentioned before. It's a use of probiotics, and we talk about that. So in general, there are 3 or 4 different classes of probiotics which you need to know about. So there are multi-strain probiotics, which are based on various normal strains. There are anti-inflammatory probiotics, and the most common one called Bacillus coagulans. It's a probiotic which is not normal for our gut microflora, but it's like a feeding probiotic, so it feeds your own microflora, and it also reduces inflammation. Clinical trials which were performed at Cleveland Clinic 2 years ago show that you can use Bacillus coagulans at pretty high doses to treat rheumatoid arthritis and colitis. So it's inflammatory probiotic. There are probiotics which are based on yeast. The most common one is Saccharomyces boulardii. So this is a probiotic which is resistant to antibiotics. And when you take antibiotics, which typically like to combine higher dose regular probiotics and also Saccharomyces boulardii. So digestive enzymes, we talk about enzymes, and so you may ask me, what's the connection between our microflora and enzymes? Well, if you're deficient in pancreatic enzymes when you consume food, big chunks of food, they're not getting digested. So they end up in lower portions of your intestine, and they trigger fermentation, yeast overgrowth, and things like that. So you need to use digestive enzymes to keep your gut clean. Epicor is a patented product, which is an extract from the brewer's yeast. There are quite a few clinical trials which were done with Epicor, and routinely Epicor used for people who have IgA deficiency, not complete but partial IgA deficiency, and for those who have low mucosal immunity, because low mucosal immunity can trigger yeast overgrowth, and Epicor is part of that. We talk about sodium butyrate. So sodium butyrate, again, it tightens your gut junction, it prevents leaky gut from happening, and it has very strong anti-yeast effect. Same with L-glutamine. And finally, we'll talk about Biofilms. Biofilms, it's our featured product. So Biofilms is a combination of 3 different things. Number 1, it's a combination of enzymes which break the yeast cell wall. So it's a very useful product for patients who have yeast overgrowth. Second, it has chelating agent, EDTA. So it binds metals, and it actually facilitates the cleaning of the gut. And finally, it has some enzymes which break biofilms. So I don't know how many of you are familiar with biofilms, but every time when you have abnormal population of microorganisms in your gut, they make kind of, you know, almost like slim, and it prevents basically our body to cleaning them up. And so biofilm breaks all these extra, you know, surfaces and shells and clean up your gut.